here. I have been treating Sarah for quite a long time,
Yeah.
I feel.
And at least
And
a year or two.
yeah, it feels like a long time
Yeah.
because the biggest thing I feel with EDS is that every time you see a patient, it's something different. Because, and Sarah, I'm sure you can attest to this, it's because there's so many associated things with EDS that every single time it may not just be, back pain or neck pain or headaches, but there may be other comorbid conditions with EDS that could be manifesting as something else. So that's why, being able to identify EDS is so critical, that because there's so many different things that can contribute to the symptoms of EDS, but also to, day-to-day changes in a patient with EDS's life. So I know you guys have a great presentation, and I'm sorry I can only be here for a little bit because my son needs to be put to sleep. So I'm happy to however you guys want to kind of have this meeting flow. I am open to whatever you guys want to do.
So we will start with our list of questions, and
Great.
if anyone has any questions they would like to ask, feel free to speak up or type them in the chat. Okay, so let's start off with how does your job help people with EDS?
So for those of you who aren't familiar with osteopathic manipulative medicine, so in the world of medicine right now, in terms of just like general medicine, there's two types of degrees that you can get. You can get your MD, which is the thing that everyone identifies as a physician. And there's also a DO, which is a doctor of osteopathic medicine. So those physicians can actually do everything that an MD does. But in osteopathic medical school, we learn a different approach to patients where we're looking at the whole body and we're looking for restrictions to motion, we're looking for asymmetries in your posture, we're looking for changes to the actual quality of your muscles and your soft tissues. And we learn how to address those with our hands, because one of the philosophies of osteopathic medicine is that the body works as a whole unit, which kind of makes sense, right? Like, if you sprain your ankle, you're not walking properly. So it affects a lot of other things. So we're looking at the whole body, and we're looking at how the structure of the body is affecting the function. So if something is out of whack in your structure, you're not going to be able to function as effectively. So with EDS, this is really great because EDS is a head to toe condition. It doesn't just affect your neck or your back or your shoulders or your hips. It affects every joint of your body because it's just generalized laxity or weakness of the connective tissue of the body. So our philosophy is basically catered to treating people with EDS because we can look at everything from head to toe, and not just look at, how the muscles and the bones and everything are affected, but also look at everything else associated with it and try to kind of put the whole puzzle together. So it really works well for long-term and preventative health, which is why we have a lot of EDS patients that we see in our office.
And so when you're treating EDS patients, how do you do things differently than you would a non-EDS patient?
Not honestly, not that much different. The biggest thing to keep in mind is that in EDS, the joints are very hypermobile. So someone can just throw their leg out and it looks like they're doing a split. But when they try to actively engage their muscles, they can't do that, because what happens with EDS is that the muscles tighten up around these joints to create that stability that's lacking within the joints themselves. So the big thing is that we need to address this tightness and help relieve it so that way we can guide a patient with EDS towards a good strengthening regimen to help tone the muscles to create that stability in a healthy way, as opposed to what we call a pathologic way, where it's so tight, it's creating the stability, but then that creates pain. So there's a lot more guidance that we do that with our non-EDS patients, because we have to make sure that what we're doing is not exacerbating the laxity that they already have in their joints.
Yep, definitely. And one other thing with that, with the tightness, to be able to do the strengthening, even though it seems counterintuitive, you do need to loosen the muscles so that you can do the strengthening, because otherwise
Exactly.
you can have a reduced range of motion, which
Exactly.
sounds good, but can be bad.
And then I have these. I don't like the full sleeve ones. They're long sleeve. Yeah.
Okay, oops. No, go back. Okay, here we go. And I don't know if you've treated different types of EDS, but do you see them presenting differently if you do?
I mostly have hypermobile EDS patients in my practice, but I have had a couple classic type EDS. They all present roughly the same way. There is that the joint instability, there is, the elasticity of their skin, and the comorbid other conditions, like with the GI tract and with, headaches and those sort of things. So in general, no, they all present pretty similarly, but when it comes to understanding the different subtypes, it does involve different types of management.
Sorry to interrupt, but we do have a question from the chat. Someone asked
sure.
if EDS and scoliosis are often related, or if they're related at all.
Good question. So it's not like a diagnostic criteria to have scoliosis with EDS, but if you think about it, if you don't have the stability in your joints, then things are going to morph a little bit. So scoliosis can be a presentation of a patient with EDS, but they're not necessarily directly correlated. I hope that answers your question.
But there is an increase, at least from what I understand, an increased comorbidity.
Yes, there definitely is.
The other types of spinal curvatures.
Oh, absolutely. Absolutely. There is an increased incidence of scoliosis in patients with EDS, but it's not necessarily a diagnostic feature per se.
I don't know if you have the answer to this one either, but do you know how many EDS patients that you've treated?
I don't. So the thing is that our clinic, we specialize in this osteopathic manipulative medicine, that hands-on approach to treating patients with various complaints. And the thing with EDS is that I'm sure if any of you have EDS, there are support groups on Facebook and social media and elsewhere. And once one person finds something that works for them, they tell it to everybody. And so at one point, our clinic, not me specifically, but our clinic was getting patients. We're located in Philadelphia. We are getting patients from Vermont and from New Jersey and from Maryland and all over the place, because of the fact that we know what EDS is, and we know how to diagnose it, and we know how to guide someone towards a good treatment regimen. So I was just telling a patient today who was a new patient to our practice that was diagnosed with, had the clinical features of EDS. I said, we have a high concentration of patients with EDS because they seek us out because of what we do and how we can address the body. So I would say right now in my practice, I probably have maybe like just about a quarter of my patients may have EDS, some sort of hypermobility, but also along the spectrum of EDS. So Yeah, it's quite a bit,
Yeah.
quite a good number.
Yeah, especially considering that approximately 1 in 5,000 people have some form of
Mhm.
EDS.
Absolutely.
And that's how I found you. I was on a Facebook group and someone suggested you, and I was like, yes, thank you. Okay. So what would you recommend EDS patients doing / not doing?
The main thing I recommend EDS patients to do is to have a good physical therapist that they can work with consistently. What it doesn't have to be year round, but someone that understands EDS, that can work with them and make sure that they're not pushing them past their limits, to kind of use the muscle tone that they have and build upon it, and use the flexibility that they have and build upon it, as opposed to pushing them through to things that they may not be able to do. So that's, I guess, a do and a do not. Don't overdo it when you're trying to do your stretching or your strengthening, because you are at risk of hurting the joints if things aren't done well. But if you have someone that can really work with you, whether it's a physical therapist or a Pilates instructor, or someone that can really like work within your limits and build upon that, that's probably the best thing. And also to get a good team of physicians with you to kind of oversee, because of the various complications that you can have with EDS.
Yeah, definitely. And having doctors who know about it, but also specifically with physical therapy, knowing what exercise you should and should not do. I've
Absolutely.
had some in the past that have had me do things that purposely hyperextend me. I'm like, no, I shouldn't be doing that.
Yeah.
Okay. So what would you want patients to know about EDS?
Good question. That it is kind of a spectrum of a disease where not every single patient presents the same way. So one person with EDS may have certain features and someone else may not have those features or have a lesser degree of those. So it's not like, if you have high blood pressure, your high blood pressure management may be the same as the next person. It's more so how is EDS impacting you individually? And therefore, that is important to be able to create a treatment plan for you and your needs, as opposed to just a generalized one. So it's more of like being able to advocate for yourself.
Definitely. What do you want the general population to know about EDS?
It doesn't just mean that you're bendy. There's a lot more to having EDS than just being bendy. There's a lot more other associated features with that. And that it means that maybe, you may not be able to go and do that activity that someone else is doing, because it involves maybe a lot of strain on joints or hyperextension or whatever. But just to be familiar with it, so that way, if you're doing something, if you have someone coming to an event or whatever that has EDS, you can cater to that.
Definitely. Okay. And what do you want doctors / physicians to know about EDS?
I just wish that more primary care physicians especially were able to identify features of EDS. Excuse me. And so to be able to screen in a primary care setting, as opposed to just shooting them to various specialists, whether it's an orthopedist or a sports medicine doctor, or even honestly my practice. We get a lot of patients that come to us that are like, no one knows why we're having this pain, or no one knows why my joints keep popping out of place. And we're able to tell them, because that, is part of our specialty. But if there was just a generalized understanding of what it is, it would save patients so much more time and money, to be honest.
Yeah, And stress.
And stress, yes, big stress, absolutely.
Yeah. Okay. Does anyone have any other questions they would like to ask Dr. Patel?
Do you guys actually diagnose EDS at your clinic there?
So we can screen for it. There's first, I'll clarify for specifically the hypermobile subtype. So we look at a patient's history, obviously, and any other past medical history that they may have. And, and specifically if someone comes in that we're suspecting that may have some subtype of EDS, we look at, their joint mobility, or hypermobility, I should say, if they have any chronic pain, if they have any heart issues or any family history of that. And then we kind of take all that into account. And there's certain things that I observe. One of the things I tell my medical students all the time is that your assessment of your patient starts from the moment you see them in the waiting room. So you see how they're walking, you see their posture, and there's certain things with EDS you can see, like the positioning of their hands, the positioning of their knees when they're walking, when they're lying on a table, how forward flex their feet are, that kind of clue you in that maybe there's some hypermobility there. So you have it later on in this presentation, so I'm not going to take away from that, but there's a screening guide for specifically hypermobile subtype, but it kind of can clue you into other, maybe not necessarily the hypermobile subtype, but other subtypes of EDS. And if you're suspecting it, then we know to refer to a other subspecialist, like a cardiologist or even a physician who specializes in genetics to do more of the genetic testing associated with some of the other EDS subtypes. And then we can then also guide them towards the physical management of it, whether it's physical therapy or Pilates, and even the manipulation that we do just to help take off the tension from the joints to allow the muscles to work a little bit better.
Mm-hmm.
And we have a question in the chat. What made you want to go into osteopathic manipulative medicine?
Very good question. So when I always knew I wanted to go into medicine. I always knew I wanted to go into pediatrics specifically. I always loved kids. I was one of those weird kids that liked going to my pediatrician's office because I thought it was really cool. I actually worked there when I was in high school and college over the summer. A lot of bruises on my knees from getting kicked by other kids, but it didn't deter me from wanting to pursue that as a field. When I was applying to medical school, I didn't know much about osteopathic medicine, except that the academic requirements were a little less stringent than MD schools. So I honestly didn't have the greatest GPA. I mean, I was doing well in college, but the pre-med classes are pretty tough. Some of you, if you're pre-med, And so I was like, you know what, let me try my hand at just getting into medical school because my ultimate goal was to just be a physician. And then as I was applying to these osteopathic schools, I was learning more about osteopathic medicine and its philosophy. And it has that whole person approach. And it's very rooted in preventative care. So finding the root cause of an issue and addressing that as opposed to just treating symptoms of a condition. And that really resonated with me as wanting to go into pediatrics because obviously I want kids to be healthy. And so I don't want to just keep slapping band-aids on things. I want to make sure that we're treating and fixing the cause of of a problem that may be happening over and over and over again. So it kind of shifted my focus to more towards osteopathic medicine. And then when I got into school, I learned about the actual hands-on aspect of it. And to me, it was one of those things that just made sense because if I have another tool in my tool belt to help treat my patients in addition to, the traditional medicine that we all think of, whether it's medications or ordering special tests or sending to a specialist or whatever. But if I have something else that may help all those other things work a little bit better, why wouldn't I want to use it? So I was really drawn to that. And I actually spent an extra year in medical school working in our clinic that's similar to the one that I work in now, and teaching students and just really honing those hands-on skills. And it really solidified that this was going to be an important part of my future. And now it's what I practice. So I am a pediatrician, but I specialized in this osteopathic manipulation.
Okay, so we have another question saying, hello, Dr. Patel. These meetings have been my first time hearing about EDS. Why do you think EDS isn't widely understood in medicine and by the general public?
Very good question. It's because, in my opinion, it's because EDS, there's a reason why the zebra is the mascot for Ehlers-Danlos. Because in medicine, when we say it's a zebra, it means it's something that's very unknown or very not the common most thing that you would think of as the diagnosis of a patient. And the reason why is that EDS can present so differently. Someone can just have the elastic skin, someone can have the joint hypermobility, someone can have just a heart issue, like an aneurysm or a dilated valve or something like that. And so it's not the same consistently like something like diabetes, where if someone has diabetes because they have high sugar, if someone has high blood pressure because their blood pressure is high. So, and this list right here, exactly the last sentence. So essentially everything, there it is. And so I think that's why it's probably last on the list of things that a doctor would look for. But for us, we're specialists in the body, in the musculoskeletal system, in the connection between the musculoskeletal system with the whole body. And so this is one of the things that we 100% look for, because it can have such a head to toe impact, and that just goes along with our philosophy. So yeah, it's one of those things that I guarantee you, if you go and ask your primary care physician, they'll be like, what is that? And then you show them like the website and they'll be like, I remember learning about that maybe one class once in medical school, and probably never brought to their attention ever again.
They probably learned about the connective tissue and that it can go wrong, but not specifically what EDS is and all the implications that it has.
Yep. And full disclosure, until I got to doing my fellowship training and working at PCOM, where I work at right now, I knew very little about EDS. And the more I learned about it, the more I was like, wait a second, I can name like 10 patients from when I was in my pediatric residency training, when I was a medical student, that I remember that I was like, something is just doesn't seem right. This doesn't just make, this isn't just like tight muscles. This isn't just like back pain. There's something more to this. And I realize now that those patients probably had some degree of EDS, and I just wasn't aware of it, except for literally one class in medical school where we learned about abnormalities of connective tissue, but it wasn't something that was emphasized down the line. So it's definitely one of those things that I personally, when I have a new patient in my office, or if I see anyone, whether it's family or friends or whatever, and they're coming in with they're like, oh yeah, I did this, and I think I like popped my shoulder out of place. I'm like, could this be? And then I think I like look at them and I observe and I maybe do an assessment, especially with patients in my office. And if they have features and meet the criteria, that I know how to guide them further.
And to add on to the zebra thing, the quote is, when you hear hoofbeats, you think of horses, not zebras. So as Dr. Patel was saying, like when these kinds of symptoms present, it's not the first thing you think of. So it's not something that's easily recognizable by people.
Absolutely.
And also to do with that, this is a quote from Rodney Graham, who is a leading expert in EDS. And he says, no other condition in the history of modern medicine has been neglected in such a way as Ehlers-Danlos Syndrome. So I would say it's probably true.
Very true.
Hardly any of my doctors that I've seen knew about EDS. And if they did know about EDS, I went to them because I knew about EDS.
Any final questions for Dr. Patel?
I'm putting my email in the chat. So if anyone has questions after the whole presentation, because I unfortunately have to skedaddle, please email me. I'm happy to answer any questions. And not to, toot my own horn, but if anyone is interested in learning more about osteopathic medicine, also email me. We do allow shadowing in our clinic. And, we're always happy to expand our profession and teach people about what we do. So please, do not hesitate to email me. And thank you for having me. This was awesome. And I'm so glad that there's a club at the college level that talks about these invisible illnesses, because it's great to have more awareness out there. So good job, you guys. This is awesome.
Thank you so much for joining us.
Thank you for joining us. Yeah.
Of course, and enjoy the rest of the presentation. It's a great PowerPoint. I went through it. I've read through it several times, and it's very, very thorough. If you don't know about EDS now, you will by the end of this PowerPoint.
Thank you.
Thank you very much, Dr. Patel.
Bye, everyone. See you soon, Sarah.
Yep. See you next week. Bye. All right. Well, we will introduce our next two special guests. We have Mikey and Amanda. And would you guys like to introduce yourselves? Mikey, do you want to go first?
Sure, I can go first. So like she said, my name is Mickey. I'm 21. I'm 21 and have classical EDS. I was diagnosed when I was about 15 or 16. And it affects my body in a bunch of different ways. So I have all of the joint stuff. It also affects my GI tract. So I have a feeding tube because of gastroparesis and other intestinal dysmotility. I have a port in my chest that I get regular infusions every week for my dysautonomia as well as my gastroparesis, not being able to hydrate myself. And yeah, so it affects my body in a lot of different ways. My mom actually has it as well. I got it from her. It's genetic. So yeah, I've been diagnosed for a while and I'm happy to be here and talk about it more.
Cool. I'm Amanda. I'm 22. They diagnosed me with classical when I was 8, but as I've gotten older and know the symptoms better, I'm pretty sure I have hypermobile type. They didn't have genetic testing for classical when I got diagnosed, so I never had a genetic test for it. So I could get that done to rule out that I for sure don't have classical. And for me, it comes in as I do have the joint issues. I have the skin issues. I have orthostatic hypotension, which is a type of dysautonomia. So that's really affects me a lot. And I also have suspected celiac, and that's how it affects my GI.
And most of you probably have heard somewhat of my story. I'm Sarah. I am currently diagnosed with hypermobility spectrum disorder, but it is suspected that I have hypermobile EDS, but no one wants to diagnose me with it. So right now I just have the hypermobile spectrum disorder diagnosis. But pretty much every doctor who knows EDS is like, yeah, I'm pretty sure you have EDS. Okay, so let's get into the questions. So, and both of you guys sort of went over this. What is your experience with EDS? And how long did it take for you to get diagnosed?
I guess I can go first again. So my experience with EDS has been really kind of all over the place. So I was diagnosed, like I said, when I was about 15 or 16. And at that point, we had been, quote unquote, like looking for a diagnosis for a couple of years. I was really not too sick as a child. I had some health issues growing up, but it wasn't terrible, definitely nothing big enough to like lead to a diagnosis. And as I got older and, you know, hit puberty, was in my teenage years, it started to get a lot worse, which is why we started looking, and I was diagnosed with EDS. But I feel like in the span of, I'm now 21, from, you know, 14 to 21, my experience has changed so much over the years. In the beginning, you know, I had mainly joint issues. That was my biggest concern that I dealt with. And then, you know, a couple years later, while I still had the joint stuff, my stomach stuff was the main focus because that was the worst. And so I find that it changes so drastically over time. So it just depends. Yeah.
What about you, Amanda?
Yeah, mine is definitely pretty similar. It totally depends. I feel like it's just one thing right after the other. Actually forgot to mention earlier, I was diagnosed because I had a heart murmur. So that was how they discovered I had Ehlers-Danlos. And I didn't have I had symptoms as a child, totally. They were minor though, and my parents just didn't know what was going on. And I actually didn't have too many issues up until high school, and then it kind of just rapidly went downhill. I had really bad chronic foot pain, mostly, and then I had my celiac diagnosis, or potential celiac, and then I got my orthostatic hypotension. It was just all down in a row. So been good for a little bit now without the diagnosis of comorbidity. So I'm trying to like keep it on the track.
Yeah, definitely. This is a big thing for me that now I'm realizing, looking back when I was younger, I didn't know I had EDS, but looking back on it now, I'm like, yeah, I really did. Like when I first heard about it, I was like, no, I don't think I have that. But then looking back on it and hearing more stories about what EDS is really like, it's like, yeah, I definitely did. Like I remember specifically for the presidential fitness testing, always bad with everything except for the sit and reach. Got the sit and reach down. Every time I made it the farthest, then they were always like, are you cheating? I'm like, no, I just have hypermobile knees.
Yeah, I feel the same way with looking back. Like my symptoms weren't prominent enough to lead to a diagnosis on its own, but after being diagnosed and looking back, it's like I was so flexible as a child. Like we used to joke that I didn't have bones. I had a lot of pain. Like after every track and field day every year, I would come home and we'd have to put ice packs on my legs all the time. Anytime I was really active, I would get what my doctors called bone pain, or growing pains. I was diagnosed with growing pains over and over and over again. And, you know, I had a very delicate stomach. I bruised really easily. And just a variety of those things that like on its own, like had a doctor known about it, maybe they would have diagnosed me. But it wasn't, until later that I was like, oh yeah, I can see that now.
Yeah, totally me too, especially with the like presidential test. Oh yeah, every time. Also, my parents used to say when I was a kid, and I vaguely remember, I would just have extreme episodes of fatigue and tiredness and dizziness and lightheadedness. And I would literally just like apparently lie on the floor and be like, I am tired. And they'd be like, what's wrong with you? You're a kid. You're supposed to be running around with energy. And I just didn't have that.
Yeah.
Definitely same here. What kind of doctor diagnosed / is treating your EDS? And have you had genetic testing? You guys are...
I have had genetic testing. I was diagnosed by a geneticist when I was 15. I think I was 15. And at that point, I was actually diagnosed with hypermobile EDS. I had that diagnosis for about 4 years. And at that point, they didn't do any genetic testing. He was like, yep, this is what you have. And at the time, I was actually kind of convinced that I didn't have it, out of more denial. I really didn't want to have it. So I was kind of like, okay, fine, whatever. And I didn't really push into looking more into it. So I was like, okay, all right, cool. And then, as I got sicker over the years, a lot of my doctors were like, I kind of think maybe you should get that genetic testing, because your symptoms are, so sorry about that. That is my feeding tube pump going off.
And you want to point out for the people who don't know, you often with EDS will get genetic testing because it is a genetic condition, but there is not yet a gene specified for the hypermobile type.
Yep. Yeah. So there's new types of EDS being found all the time right now, and they're doing a lot of research towards it. But the kind of most common type is hypermobile. And yeah, there isn't a gene known for that right now. But so I went back to the geneticist when I was 18 or 19, and did the genetic testing, and it turned out that I do have classical EDS, and as well as my mom does. And so as for what doctors are treating my EDS, I would say, the person that I see the most often is my physical therapist. I go to physical therapy every week. But I'm seen by orthopedics. My neurologist is like one of my go-to. She's incredible. She's another one that kind of looks at the whole picture. So, but she treats my dysautonomia and some of my other stuff that I have going on. My GI doctor is a big one. Like I said, I'm on a feeding tube because of my issues, so I follow closely with GI. Let's see, what are some other, those are kind of my biggest that I see all the time. I'm trying to think. Endocrinology. Also, endocrinology is a big one for me. But I think those are kind of the main ones that I see that I can think of right now.
What about for you, Amanda?
So like I mentioned, I have not had genetic testing because I'm pretty sure, I could be wrong, but I'm pretty sure when I was diagnosed at age 8, they didn't have genetic testing yet for classical.
That was a more recent thing.
Yeah, so I never had the genetic test for it. But I suspect I have hypermobile type, so I could see and knock it out and make sure I for sure don't have classical. But I don't know, just knowing I have EDS is very, like, a good confirmation for me, and having a diagnosis is, something I'm pretty thankful for, and for having it at such a young age too. Honestly, I was just diagnosed by probably my primary care physician and my cardiologist. I've moved around a lot, so unfortunately I don't have the same ones, but I still do see a cardiologist, primary care, and I also see a podiatrist for my feet. I have been to other doctors like neurologists, but I guess I don't really have any significant symptoms yet in that area. And I have been to physical therapy and I really loved it, but I don't have a lot of financial means, unfortunately, to get some of the treatment I could benefit from.
Yeah, could definitely go on a whole rant about that.
Yeah.
And especially with EDS, as the case is with Dr. Patel, sadly, insurance doesn't cover her. So I see, obviously, Dr. Patel is honestly, I would say, my main EDS doctor. She has helped me the most in terms of my EDS, and my physical therapist, and somewhat of my POTS doctor, and also my gastro doctor. Like I said, I haven't officially been diagnosed, and I could get genetic testing to get the official EDS diagnosis, but honestly, since I have the hypermobile spectrum disorder, and it tends to have a lot of the same symptoms as EDS, and it can be just as severe as EDS, and thankfully I found doctors who know that. So I'm not super concerned with rushing to get an EDS diagnosis. Okay, let's see. When did you start experiencing symptoms?
I can start first this time. So like I mentioned, I've had like kind of the dysautonomia since a very young age. But I didn't actually start having joint issues up until high school. So not until like freshman year, not until I was like 16, was I starting to have regular joint issues. And then a few years later, I had my GI issues. And then another few years later, my dysautonomia just got so bad that I had to go on medication and stuff for it.
I had kind of had a similar situation where it kind of like slowly progresses often, and I see that being the case in most people with EDS. I had, so when I was in elementary school, I was on a swim team, but because I was having so much joint issues, especially with my shoulders, I had to stop doing it because it just wasn't very feasible. But at that age, that was the only symptom I had really, and then started to spread to my other joints and then to my stomach. Yeah.
Yeah, I mean, I had some symptoms as a kid that I kind of mentioned, but like Amanda, my stuff really got worse around my teenage years, is when I started to, it noticeably affected my life.
So, what makes your EDS better and what makes it worse? It's kind of a tricky question.
Yeah.
Okay. Oh, sorry. Do you want to go?
No, I was just agreeing with her that it's a tricky question.
Okay. Yeah, no, it totally is. I feel like almost I have an easy answer partially, because I do have gluten intolerance / possibly celiacs. That is something that actually does affect my symptoms. If I accidentally eat gluten, it's like a instant effect on my joints. They instantly start getting really bad. So that's something that easily can make my joints way worse, is if I accidentally eat gluten. Honestly, I feel like the weather kind of affects them too. It also, I feel like, affects my dysautonomia. What makes it better? Honestly, I don't know. Just like making sure I actually like eat really good food and stay hydrated, I feel like is the biggest thing, and sleep. It's just basics for me, I feel like.
Yeah, I feel like what makes my EDS better out of anything is just taking care of myself, making sure that, you know, I stay up on my medications and my physical therapy and, you know, my feeds, making sure that I'm doing all of those, you know, things every day or every week that I can do, because, you know, there isn't a cure. There's not anything like specific that I can do to fix myself, but, you know, keeping up on physical therapy helps keep my joints in the best condition that they can be. You know, and just making sure I take my meds and do all that kind of self-care stuff every day kind of helps keep me on track. What makes it worse is a tricky one, because I would say that answer is different for every different part of my condition. So like my stomach, what makes my stomach worse is going to be different than what makes my joints worse. So, you know, being overactive or pushing myself too far in kind of would work for every single area of that. But yeah, so that one's kind of a tricky one.
Yeah. Yeah, it is. Oops. Yeah, go back. No. There we go. Okay. For me, I would say what makes it worse would be my mast cell activation syndrome. When I have something that I have a reaction to, my EDS definitely flares. Makes it better. Yeah, I would say pretty much what you guys said. I would say also resting. It at least stops it from getting worse usually.
Yeah, rest is a big one for me as well.
Knowing when to rest is a big one.
Yeah, that's a really, that I'm glad you brought that up, because that is a really good one. I rest so much more than the average person. Like if I spend if I go an entire day without spending an hour or two specifically designated to like quote unquote resting, like where I'm not doing anything else, I'm not like, you know, even just I'm just sitting on the couch isn't resting enough for me. Like I need to actually like devote time every day to just resting my body. Otherwise, like it can be hard to get through a day. So that's a really good one that you brought up.
And the other thing, when you push, it doesn't just like slightly increase your pain, it kind of exponentially increases it.
And then you have to come back from that too. When you push yourself over the edge and you're like, if you do that and your joints get really painful, it's not like when you rest, then all of a sudden it goes away. No, then you got to play catch up. Like, then you have to recover from that.
You need a day or two, or at least, if not more, to be able to just get out of bed again.
Yeah, absolutely.
What helps most with your pain?
Rest and medications, as well as physical therapy. My physical therapist does a lot of, you know, myofascial work where she works on my muscles, and she, you know, helps kind of with my alignment and other stuff like that. So I find that to be really beneficial. Yeah, and then just medications and resting when needed.
Yeah, same, just resting and trying to not put too much pressure or exert my joints too much.
Yeah, definitely. Okay. Do you use any mobility aids / braces? I should say / splints also.
Who wants to go first?
You can go first.
All right, I will. For mobility aids, I use a wheelchair for longer distances. I've had a custom wheelchair now for probably 4 or 5 years, and that has been super helpful. I also use a forearm crutch on one of my arms. I find that I can't use it on both arms because my left arm is not quite good enough. So I use that when I'm walking outside of the house. Inside of the house, it's short enough distances that I'm fine. And if it's a really short distance outside of the house, I can sometimes be fine without it. But if I'm going to be, you know, going through a store or something, I need to have that for stability. And braces. The only braces that I wear or splints on like a regular basis would be my ankle braces. I have the like custom plastic molded
ATL or whatever it's called, something like that. ALT? No, I don't know.
They're AFOs and SMOs.
Yep.
Those are, yeah, So I have those that go in my shoes, and I wear them often, most of the time when I'm out of the house. But otherwise, it just depends on, like, if I'm having a really bad issue with my shoulder, I might be in a sling, or if my wrist is really bothering me, or if I get injured, because people with EDS get injured really often, then I might be in a brace for that. So yeah.
I don't have any what I would consider mobility aids yet. I'm at the point where if I go out though for a really long period of time, especially somewhere where I'm going to be walking a lot, I think it would be really beneficial if I had like just a walker with a seat, because I find a lot of times there's no place for me to sit. But I haven't bought one yet, but it's kind of like on my wish list. I do have a shower stool though, for safety.
It must.
I'm very terrified of that. Yeah, that's like a big fear. I also, for like braces and stuff, I also do have custom shoe orthotics for my feet that I wear every single day. I don't usually need to brace every day either, but I do have braces for like my shoulders, knees, and wrists. I would love to at some point get, custom splints for like my hands and, braces for other places. But like we talked about briefly, financial reasons. But yeah.
Yeah. I do use a wheelchair, well, especially between EDS and POTS. Definitely, if I'm going for a long walk, I definitely need a wheelchair. In terms of braces, I do have a shoulder brace I use very occasionally when I pop it out and it's really bad, and sometimes ankle braces, but that's about it. Okay. What has EDS changed for you? So in other words, like what? Well, the answer is kind of everything. I know.
That was gonna be my answer, everything. My life really kind of feels like a before and after photo, like those ones that you see, like, oh look, this is before, just anything. Like my life kind of feels like a before and after photo. I was a dancer, I was a figure skater, like I was a competitive dancer. We traveled all over the country every weekend for 8 weeks in a row in competition season, like 5 a.m. to 1 a.m. like all day competitions. Like I was very active. And I was in school, I was healthy-ish, like I've always had health issues. But then when things kind of started to go downhill, like I had to be homeschooled because I couldn't get around school anymore. I had to stop figure skating, I had to stop dancing. Not only like the social aspects of all of that, but also I lost my ability to eat. I lost my ability to just be able to walk around the neighborhood. Like I had to adjust everything in my life to fit around this new monster that I was dealing with. And so it really has just changed everything in my life. Some for the worse, some for the better. I think perspective wise, I have a much better outlook on life now than I did then, because some things you can really only gain through perspective. But yeah.
True. I would say that is just such a loaded question. Honestly, it's made it harder to be independent. Especially, I live alone, college student, and it's really difficult, like just doing basic things like my laundry and my chores. It's like a whole day thing. It's really difficult. when I've had significant others in the past, I enlist their help to do the things that are just so strenuous. But when I don't have anyone, it's just a lot. Like I can go out for groceries and I come back and I'm on the edge of like passing out. It's just really frustrating. But I don't know. I push through it. It doesn't bother me too much. I do miss eating gluten a lot. I'm not kind of a silly
Same.
one, but I really do. I don't know. I feel like really that's it, is that it's just affected my independence.
Yeah, definitely can relate to that. This is a really good quote from Camilla Jamil. Ehlers-Danlos Syndrome is always at the forefront of your mind because it affects every single cell in your body. And so every micro decision you make is in consideration of Ehlers-Danlos Syndrome. For someone to discard that just because you look okay according to their own Bible of ableism is very hurtful. I find that is definitely the case. Okay. Okay. Let's see. And again, the answer to this one, I'm sure, is yes. But have you had bad experience with doctors and EDS?
I personally actually haven't, but that's just because I was diagnosed young and with like a pretty regular doctor. I have had some not so great experiences, telling me that like my symptoms are caused by other things and not what I like, just like not really fully listening to me. But thankfully I haven't had anything too bad.
That's good. Not specifically, well, somewhat specifically with EDS, but especially with invisible illnesses in general, a lot of doctors will say either, it's just anxiety or some other mental health issue, or you're just making it up for attention, or, it's like, yeah, I can just move my arm like this and pop my shoulder out of joint. I'm making it up. Okay. And these are same questions that, yes, Dr. Patel, if the public were to know one thing about EDS, what would it be?
Okay, so sorry about that.
Are you good? Did your computer die?
And I'm gonna tell you, it was for the stupidest reason ever. You were screen sharing your screen. I'm just bringing my charger downstairs. And so when the little low battery thing popped up, I thought it was your screen and not mine. Because I thought that I wasn't looking at my screen, I was looking at yours. And so, because I had plenty of battery when I came down here, although I guess if you guys weren't here earlier, my boyfriend is also watching this. He can attest to the fact that my devices die all of the time. So that is 100% my bad.
Well, you didn't miss much. The main thing you were talking about is, have you had bad experience with doctors and EDS?
Yes. Definitely I've had bad experiences with doctors and EDS. I've had some that come to mind are some surgeons that I've seen that didn't quite know about EDS, because a lot of the doctors that I do see aren't surgeons. And so if I need a surgery done, they have to refer me to somebody else. And like when I've been inpatient in the hospital, like when I needed my port removed, I'm sorry, my dad got home from work, so the dogs are going crazy upstairs, excited. When I had to get my port removed, the surgeon that was on call there didn't really know a whole lot about EDS. And so he was telling me like, well, EDS doesn't affect your blood vessels or anything. So I'm sure that the fact that we're dealing with an artery here isn't going to be an issue. And I was like, instantly faith in you is lowered like through the floor. But I've had other doctors who didn't understand the pain of EDS, or just in general. I think one of the biggest things, now that I have a solid diagnosis and I have all of those things, I find that I have less issues, which is unfortunate because so many people who don't have the luxury of having that diagnosis yet, or are still looking, like, I hate that unfortunately sometimes that's what it takes to be taken seriously. And so I get a lot less of that now, and I think advocating for yourself and being a really good advocate helped. In the beginning, I wouldn't stand up for myself as much as I do now, but yeah, I think that's kind of my take on that a little bit.
I would say definitely that. The other thing is, early on I had trouble with doctors not knowing what it was, but asking doctors or other patients that have EDS about other doctors that know about EDS has helped a lot. So because of that, I haven't had as much issues recently. Okay. Oops. Yeah.
Let's try to combine the last couple questions together. So if you want, what would you guys want doctors and the public to know about EDS? Like, what are the main things?
For me personally, honestly, I just want people to know of its existence, because I feel like that's the first step to having people understand it, and then having like people like doctors learn how to treat it.
Yeah, I would absolutely agree with that. I think one thing that I wish both doctors and patients would understand is that, like Dr. Patel said, it's such a spectrum. And just because you've seen one EDS patient that has this doesn't necessarily mean that another patient will have this. If you go to a doctor and you're like, oh, my, like, this joint is hurting me really, really bad when it comes out of place. And they're like, well, the other person that I have with EDS, like, it doesn't hurt that bad when their shoulder comes out of place. So like, why does yours hurt that bad? Like, and in severity of symptoms, it can be different. And just because one person has worse symptoms in this area doesn't mean that the other person isn't just as equally affected by their EDS. It's just in different ways. And that it can vary so much day to day. I know when I was first getting diagnosed and first getting sick, it was really difficult for people around me, especially like friends and the people at my school who've known me forever. And I was able to run around and do dance and all these other things, and then suddenly I wasn't, and they couldn't really understand, because one, they didn't know what EDS is. Nobody had ever heard of it before. And some days I'll be walking just fine, and other days like I'll need a wheelchair and I can't hardly walk at all. Like, it changes so much from person to person and from time to time. And I just wish that everyone would take the time to listen to whoever it is that has the condition, and ask them, all right, like, how does this affect you? Like, really just have an open mind, and know that everyone is different, and just be gracious and patient with them.
Yeah, definitely. And like we were saying, it affects everyone so differently. Even when like doctors were starting to suspect that I might have it, and asking about it because of having POTS and mast cell means I'm more likely to have EDS. So they're like, do you have EDS? And I was like, I don't know. And I was looking at you, Mickey, and other people, especially like on Instagram and stuff, and seeing like they had pretty severe EDS. And I was like, well, I don't have it because I don't have it that severe, but that doesn't mean I don't have it just because I don't have the same symptoms.
I actually said the first thing when they said, hey, I think you have this, I went and did research. At that point, I didn't really find anyone in particular that was, talking about it online, but I found articles and all this other stuff. And I was like, that's really bad. I definitely don't have that.
Yeah.
Because I didn't have as severe of symptoms. But like even when I was first diagnosed and it was a lot of my joint stuff, like it still took up almost the same amount of mental energy and like physical energy as when I have all of this stuff. Like, I mean, but I didn't think that I had it because it was really severe as well. But
For sure. And what advice would you guys have for anyone who suspects they have EDS or someone who's newly diagnosed with it?
I would
Be
say
positive. I don't know.
try to connect to other people with EDS, and especially if they're in your area, and ask what doctors they're seeing, if they have any doctors that they would recommend seeing. And like we said, just because you don't have the same set of symptoms as somebody else doesn't mean you don't have it.
Yeah.
Mhm.
I would say if you have been recently diagnosed, like you said, connection and support can be really helpful. I would say make sure to, if you're newly diagnosed, make sure that you're tuned in with physical therapy and other, doctors that can help you and really like form that team. Because with EDS, it does affect so many different areas that everyone kind of has to make their own, like, I don't know. It's like a sports team, like you have somebody who does this and somebody who does this, like you kind of have to have everyone working together in order to manage it. And so I spent years kind of fine tuning that team that I have now. So, making sure you have all of those bases covered. If it's somebody who's suspecting that they could have EDS, I would say, do your research and look into it. And then make sure you see doctors who know what they're talking about and are qualified to diagnose. So I know like genetics and rheumatology are kind of like the gold standard for diagnosing EDS. I know some other physicians can diagnose it. But make sure, like, if you're curious about it or you think you have it, you can bring it up to your primary care doctor. They might not be able to they probably won't be able to diagnose you, but they can kind of lead you in the right direction, kind of like Dr. Patel was saying. And just find those people who can help you and just keep looking. Like it sometimes is a trying process. And I think over the years it's gotten to be a little less trying as it's, being learned, more doctors are knowing what it is, but it still can take a while. So be patient and keep looking. If you're really sure that something is wrong, don't, you'll eventually get there, even if it's difficult. Yeah, that's kind of my answer for that one.
And persistence and
I don't really. Yeah, I don't really have too much more to add on.
So, do we have any questions from the chat?
And thank you so much, everyone, for coming out and answering questions. We appreciate you sharing your experiences with us.
Very much. And while we were waiting to see if anyone has questions, we'll briefly again go over, what we've learned. EDS affects collagen and connective tissue, which is essentially everywhere. It's rarely known about and is underdiagnosed. Can have serious impact on quality of life. Affects everyone differently. 13 types. Approximately 1 in every 5,000 people have EDS. Hypermobile EDS is the most common form. Rarest type, myopathic. has only 11 known cases. The rarer types tend to have more serious life-threatening complications. Takes average of 10 to 20 years to get diagnosed. EDS patients often use mobility aids, braces, splints, and other medical devices. There is no cure and limited treatment options. The symbol for EDS is a zebra, and EDS has a wide range of symptoms, as we saw on the slide earlier. It is very extensive.
And if you weren't here for our presentation a couple weeks ago, we do have our presentation linked in our Instagram bio under the link tree, and you can also find it in your email if you get our email subscription.
We should be putting it up on YouTube shortly also.
Yes, we'll be having this presentation on YouTube. So,
and most importantly, believe those with EDS.
Yes. Yeah.
Well, again, thank you so much for you guys coming out and answering questions, and thank you to everyone who came to listen. It's really important that we share experiences so people kind of get a inside view of how someone's life is with these different conditions. I didn't really share much. I am on the hypermobility spectrum disorder, but I don't have EDS anywhere near severe any of Mickey, Sarah, or Amanda's issues. But yeah, thank you guys so much for coming out, and thank you for being here.
Yeah.
Thank you.
Our next meeting will be March 16th, I believe. So after we come back from spring break. So nothing to worry about for a little while. And we'll be focusing on women's health issues, endometriosis, PCOS, and adenomyosis. So hopefully we'll see you there.
Yep. Alrighty. Well, it's nice to see you guys, and thanks for having me.
Thank you very much for
Thank you,
joining
guys.
us.
All right. Bye.